I wasn't prepared for this, balancing the needs of my family and of my aging parents. It can be so overwhelming. Mom has always been there for me, but now she needs me more than ever.
Well, that is part of a new campaign launched by the BC Care Providers Association, aimed at helping the so-called sandwich generation. That's all the people who, as you saw, are caring for aging parents and young children at the same time. Now, the association says if the province doesn't take a serious look at seniors' care now, we could have a crisis on our hands in the future. So it's proposing a 5-year plan with 30 or so recommendations. Among them, repurposing underused or unused care beds, refurbishing and or replacing older care homes, establishing care hubs so that people can grow older in their own communities, and increasing the nutritional choices and therapies available to people who are in care. Now, if you're wondering what all that and more might cost, they have a number for that too, $300 million a year. Now, to talk a little bit more about the proposal here, we've invited Daniel Fontaine onto the program. You're the CEO of the BC Care Providers Association. And so $300 million per year, that's the price tag. And just as important as the amount is where you want to spend it. Tell me a little bit about that.
So where we want to spend it, we've basically broken it into 4 key areas based on the public feedback and our stakeholder feedback that we had last year from 2016 during that public consultation process. 4 key areas. One is in innovation, one is in infrastructure, one is in quality, and one is in people, so the human resource side. So those are the 4 key areas, and the plan breaks down each of those components and where we would invest that money.
And why $300 million a year? Because some people might look at that number and say, that's a lot of money.
Yeah. Well, first of all, you have to put it in the context of the entire continuing care sector budget. It's a little over $2 billion. So what we're proposing is about $337 million over the next 5 years. So it would be invested each year of the next 5 years. We're also actually, if you look at parts of the plan, there would be a federal matching to that. For example, on the infrastructure side, we're looking at a $100 million request that could be matched by the federal government. So it would actually go a little bit larger than that. But, you know, as we all know, there are a lot of dollars within the current healthcare system, and we are actually calling for both a mix of reinvesting dollars that are in places like acute care where seniors are at right now, where they should be in the community, as well as new investments from the federal government and the provincial government. So in a time of a balanced budget here in BC, and the fact that we're heading into an election, we think the time is now to have this discussion.
A big chunk of that money, you'd like to see it spent on existing facilities, right? In terms of replacing and improving facilities. Can you sort of paint me a picture of how things are now?
On the people pillar, that's actually the human resource side, the labor side of it. That is the largest proposal in terms of the actual funding for dollars, and that goes into 2 key components. One is long-term care, the other is home care. So starting with long-term care, we're looking at making sure that every single care home in the province that's publicly funded, if your mom or dad or you as a senior go into that care home, you're assured that there's a floor as to what the level of that care would be. Right now, depending on where you go, depending on which care home you're in the province, some of them have funding at a certain level and others have lower funding. So we're saying to equalize all of that, so every care home would have a similar amount of funding to hire the LPNs and the care aides and the kind of staff that they need. On the home care side, for those people who are receiving care in their single-family home or their apartment, or etc., we're looking at increasing the investment around the amount of time that people can actually have access. Like currently, the minimum is about 15 minutes for a home care visit. We're looking to increase that to 30 minutes across the province. Some would argue that that still isn't enough, but we think it would be a good step in terms of making those investments.
Last question for you. How optimistic are you that you'll get what you're asking for?
I'm generally an optimist, so I'm hoping that we'll get some of it. It'll be a challenge, I think, for government to provide perhaps all of it in the first year. But I think if the federal government and the province sit down and we can negotiate a national health accord, the federal government's committed $3 billion over the next 4 years invested in Canada in terms of home care and long-term care. So if we can get that deal done, we can begin that shift, as some health authorities have already done, moving care out of the acute care into the community. I think it's doable.
And this being an election year,
this is an election year.
May play into it.
Yes, and you know, it's important, I think, for your viewers to know that, you know, when it comes to being a senior and if you're in a residential care, you're not on Twitter every day, you're not on Facebook, you're not out there, you know, advocating for the government and the politicians to pay attention for you. That's why this Care Can Be There campaign, we hope, is going to elevate the seniors and their issues to the same level as affordable housing and hiring teachers and daycare and LNG and all the other issues we hear about every day. We're hoping that the Care Can Be There campaign will do that for seniors.
Daniel Fontaine, thanks for joining us.
Thank you.